Hello everyone and welcome to our community conversation, which tonight is focused on caring for carers and ourselves. A special welcome to those who might be coming for the first time, and a special welcome to those who have already done 5 hours of Zoom today. My name is Simon Stewart and I'm the chaplain at the Cornerstone, which for those of you who don't know is part of Lancaster Methodist Church and is a community hub at the corner of Dalton Square. I think that's why I've been invited to do this tonight, because as a member of a caring community involved in frontline pastoral care, we also support numerous caring groups and charities. So that's my interest in tonight's theme. So the plan for tonight is to hear from some of the key carer supporters in our area and carers themselves. And our aim in doing that, and through our breakout conversations later, is threefold really. First, to explore how we can better support carers. Secondly, how we can take more care of ourselves as frontline workers. And thirdly, how we can be more inclusive and connected in all of this work. So we have a series of speakers and then we'll have our breakout groups. But before we go to our first speaker, I'm just going to give Kevin a moment, Kevin Goodall from the CVS, to explain anything we need to know regarding Zoom technicalities.
Thanks, Simon. Yeah, just a very quick one. I think most people know it all by now, but just let you know, we are recording tonight. That's probably the most important thing. So that video will be shared. So if you're not happy with your face being plastered all over the internet, you can turn your camera off, but it's nice to have your camera on. It doesn't affect the bandwidth of the whole meeting. So if you're happy with that, please leave your camera on, but mic's off, as you all know, by this point in lockdown. And the only other thing to mention is, obviously, we've got a chat box, so feel free to introduce yourselves to each other or to ask questions. I know Amanda Tops has been using that already because she's said hello to me. Hi, Amanda. So yeah, please use that function. It's great to use that. But other than that, I think we all know the ins and outs of it by now. So back to you, Simon. Thank you very much.
Thank you, Kevin. So yeah, do use a chat box. There will be a little bit of time at the end, perhaps, if any really burning questions need to be addressed, and to introduce yourselves, but not, as in the case of Dusty Thomas, to send abuse to the host. So first of all, our first speaker is Lucy Ellis from Parent Carers, and we'll hand it over to Lucy now. Thank you, Lucy.
Thank you, Simon, and thank you so much for including me in this conversation. I think it's very important that we've got representation from all carers across the community, so thank you for that. Firstly, I'll just briefly introduce myself. So I am Lucy Ellis. I'm a parent carer to 3 children on the autistic spectrum, and they have dyslexia, Erlen syndrome, various other bits and pieces going on. I've been a parent carer since my first child was born 15 years ago. I didn't know what a parent carer was. I didn't know what a carer was until I became one. And I think that was one of the first things for me to understand, was what a parent carer actually was. It's a bit of a breakthrough moment for a lot of parents who have children with additional needs to actually understand that role and to recognise that for themselves. So 10 years ago, I started supporting other parent carers across the local area, locally only, North Lancashire, to find relevant support and advice to help them on their journey. I hate that word, but it is a journey, to get the right support for them at the right time. So not just for their children, but for themselves as well, because you can't look after anybody else if you're not looking after yourself. So I think it's really important. That's the main focus, is to make sure that all support is for all people in the family. So I started that 10 years ago, and I've been doing it on a pretty much voluntary basis ever since. I work alongside the local commissioners in health. I work alongside the local authority. So they do appreciate my input as a parent carer, and they do seek it out. So they are prepared to listen to parent carers, which is really key. And I really value that role myself. So what I wanted to do, because I know we've only got limited time, I just wanted to give you a few facts about carers in general. Just a bit of data for those that love data, just if you're a bit of a nerd like me and you love the data stuff, this is for you. So I'm going to read it. So I feel like I'm on the news now, but I'm going to read it from some paper. So new figures released for Carers Week from the 8th to the 14th of June this year show that an estimated 4.5 million people in the UK have become unpaid carers as a result of the COVID-19 pandemic. This is on top of the 9.1 million unpaid carers who were already caring before the outbreak, bringing the total to 13.6 million across the UK. That's a huge number, absolutely huge. In the 2019 GP patient survey, it found that 17% of the population in England over the age of 16 are carers, 17% of the population. However, the significant demands of caring mean that 600 people give up work every day to care for an older or disabled relative, 600 people a day. 72% of carers responding to Carers UK State of Caring survey in 2018 said that they had suffered mental ill health as a result of caring. 61% had said that they suffered physical ill health as a result of caring. 8 in 10 people caring for loved ones say they have felt lonely or socially isolated. And I think that's a really significant fact for us all to take hold of and to use in our work that we're doing to support parent carers. Just to finish up, if you'll indulge me, I want to read out a poem that I discovered a few days ago that really accurately describes the life of a parent carer. So just bear with me on this. So what is a parent carer? To some, it's staying at home with our feet up all day, while others work our wages they pay. It's getting the offers, the discounts and deals, all to help with our children's extra needs. It's the DLA we get for no reason. It's jumping the queues while others stand freezing. It sounds so easy if these perceptions were true. Here's a few truths I'll share with you. It's the bruises we hide from the meltdown last night, from holding them until they had no more fight. It's the regimented life that we now live, for a family meal out what we wouldn't give. It's the sleep we don't get and the nights out we miss. It's the explanation to others about all of this. It's the fights that we face in every single way to get their needs met at the end of the day. It's the story you tell for the 100th time to various people you want to cry. It's the tears we hide because we're scared we're not coping. It's the smiles we paint on, there's no use in moping. It's the appointments to remember with doctors and dentists. To be honest, I'm not sure how we're not all demented. It's the progress reviews we sit through at school, hearing their struggles. It all seems so cruel. It's the stairs in the playground, the parties they don't get asked to. It's explaining to them why on the 10th time they've asked you. It's buying exactly the same pair of shoes in a different size. It's fighting the system that's already broke, but carrying on with hope against hope. It's apologising first for what is to come, the courage to go out when you'd rather stay home. It's educating teacher, family and friend about the conditions and that they won't mend. It's the guilt that we feel that we're not always enough. It's the schools changing routines that make our day tough and impacts our child in every single way. It's wanting to work but not having the time. It's the desperation to have something that's solely mine. It's giving up the job that you dearly love. It's the not giving up when the going gets tough. It's appreciating the smooth and riding the rough. It's the smiles that they give you and the light in their eyes. It's the I love yous that take us by surprise. It's the others you meet in this new way of life that gets you through the troubles and strife. It's the strength you didn't know you possessed. It's the time you went on, even when you were stressed. It's the love that you have for your child who is special that gets us through these tasks. But some understanding and empathy from others is not too much to ask. So I just wanted to share that with you because I think it really accurately reflects, and I'm really proud of myself for not crying all the way through that. I think it really reflects the lives of parent carers that are so often hidden and isolated in their homes all the time. So thank you. That's all from me.
Thank you, Lucy, for starting us with such a powerful input. We're going to move now to Colin Bowman from Lancashire Carers Service. Over to you, Colin.
Hi, thank you so much. Again, just want to pay tribute to parent carers like Lucy, who do an amazing job, often forgotten and undervalued. And it was just just emotional for me just to listen to that. So thank you so much for that. I very much appreciate it. So my name is Colin. I am a participation and engagement officer with the Lancashire Carer Service. So I just thought I'd spend this sort of few minutes, again, just telling you just a little bit about what we do, and just a little bit about what support is available to carers, because again, one of the questions that we'll be looking at a bit later on is what support is available. So our service is commissioned by Lancashire County Council, and we're commissioned to provide help and support to adult carers across the geographical footprint of Lancashire County Council. So the areas that we would obviously cover are Lancaster, Morecambe up in your area, up in the area here, and the two areas that we wouldn't cover are Blackburn and Blackpool. So one of the major ways that we actually provide support to adult carers, and it's really important that we understand what a carer is, because one of the things over the many years that I've been doing my role is that people still have a misunderstanding of the term carer, and they still don't quite understand what this word means. I've asked 10 people and got 5 different answers. And if you don't understand and identify yourself as a carer, then it doesn't really matter what support's available, because if you don't identify it, then maybe you're not going to know that support's for you. So our definition of a carer is somebody who provides help and support to another person who wouldn't be able to manage without that support. So that's the broad definition of a carer that's in the Care Act of 2014 that identifies what a carer is. So it doesn't matter whether you're on carer's allowance. It doesn't matter that you're a family member. It doesn't matter whether you do 10 hours a week or 50 hours a week. If you provide help and support to another person who wouldn't be able to manage without that support, and when we mean manage, we turn our rule of thumb is if the health and well-being of that person deteriorates because that support is withdrawn, then you are defined as a carer and then able to receive all of the help and the support that our service is able to offer. The primary way that we would actually help somebody is through the delivery of the statutory carers assessment. So everybody in the country under the Care Act has the legal right to request from their own local authority an independent assessment of their own needs, irrespective of obviously the people that you're caring for. So it means that anybody within Lancashire can ask Lancashire County Council to have a carers assessment for themselves. What Lancashire have done is they have delegated authority to a couple of different agencies and services within Lancashire to fulfill that, to be able to deliver that assessment within Lancashire. So as the commissioned carer service, we are able to deliver that service or that assessment on their behalf. And the assessment is just a great tool to be able to look at what needs those carers have. Obviously, the lockdown and restrictions, they are having a massive impact on carers. Because one of the things that we often find is that carers often would have a break from their caring role, or they would often have, an opportunity to really meet up with friends and other people. But because of the restrictions and the lockdown, they're not able to do that. So again, the carers assessment for us is a great way to look at what are the needs of the carer and how can we get that support to them that's available within their local areas. The assessment itself looks at sort of the physical health of the carer, the emotional and the mental health of the carer, any aspirational goals of the carer. And again, it works very closely with the carer to identify what they are and look at what support's available. Another thing that we do is something called the Peace of Mind for Carers plan, which is around emergency contingency planning, because quite often those conversations haven't happened between the carer and the cared for as to what happens if the carer needs to be rushed into hospital, or if there's an emergency at some point or place or time in the future. So again, what we do is we work with the carer and the cared for to identify a plan in order to make sure that some of those things are properly identified so that that carer can have that peace of mind, that knowing that there is a plan in case that carer needs to be rushed into hospital. Another thing that we do, again, is what we call our wraparound service, which is our wellbeing and support service. Because on our books at the moment, we've got 33,000 carers across Lancashire, which is just scratching the surface in relation to the 2011 survey identified well over 100,000 people within Lancashire who had obviously indicated that they had some sort of caring responsibility. So our wraparound service looks at sort of ways in which we can make sure that those carers are getting the support that they need. And an example that I wanted to bring was our carers community network. As a result of the pandemic, what we've done is we have had a custom built digital platform that's a 24-hour a day, 7-day a week peer support network for carers. And we're pleased to say that as of yesterday, we've got over 700 members on that network now at the moment. So what that means is carers at any time of the day or night, are able to log on, very similar to Facebook and other social media, and actually have those conversations with other carers and actually get that all-important peer support. There is loads of things, other things that we do around activities, and at the moment we've got something called the Care for Carers counselling program, because we recognise the psychological impact that caring for somebody else can have. So we recognise the importance of that, and obviously we've got some provision to be able to support carers through counselling. So again, it's just a really quick sort of snapshot that there is support for carers, but one of the key things that we need to do, and we continually need to do, is to educate people as to what a carer is. Identification is absolutely critical, because again, as I said, unless somebody identifies themselves as a carer, then there is that barrier to them understanding the role of the service and how we can support them. So I guess one of my leaving sort of statements would be that our aim is for the carers of today not to be the NHS patients of tomorrow. Because what we naturally see is if you do not support the carers right now, then what you end up having is the physical and emotional deterioration of their own health, which then leads them to need more support and more interventions and more NHS resources at a future point. So let's make sure that every carer today is not the NHS patient of tomorrow. Thanks very much.
Thank you, Colin. That's a great way to sign off. What you explained to us there made it really clear, but also that hope that people will be looked after properly. They'll be treated with respect. Our next speaker is Sophie Horner, who is from St. John's Hospice. Over to you, Sophie.
Hi, everyone. I have some slides which I'm going to try and share. I'm not great at this, so just give me 5 or 10 seconds.
I've got them here as well, Sophie, if you want me to share them.
That'd be brilliant if you don't mind.
Oh, host is disabled participant screen sharing.
Oh, I didn't mean to. So do you know what? I'm going to chat. I'm going to put myself on
Oh,
hide
here we
me
go.
and I'm going to... Are we good?
Is that sharing?
Yeah.
No.
Yeah. Yeah.
Fantastic. Tell me when you want me to move you along, Sophie.
Okay, thanks very much, Claire. So I'm Sophie. I'm from St John's Hospice. Covers North Lancashire, South Lakes and parts of North Yorkshire as well. In terms of our standing locally, we're one of the few care organisations that the CQC have judged outstanding as overall. So in terms of our care, that's something we're really proud of. Thank you, Claire. Next slide, please.
Sorry, it's a bit slow.
So just going to give you a really short presentation tonight about the hospice, really to let you know what we do in terms of care for your community. Hopefully you're going to find out something new, and I'd love your views on how we get people talking about hospice care. Thanks, Claire. So what I'd like you to do now, 10 seconds, I say the word hospice, scribble down the first word that comes to your mind. So jot it down on a piece of paper, napkin, whatever's to hand. Okay, thanks, Claire. What services do you think St John's Hospice provides? And again, just scribble it down. No one's going to mark your homework. just write down what you think we do. Thanks, Claire. So I'm going to tell you now what we actually do. Thank you, Claire. So we've got an inpatient unit, which I'm sure a number of you wrote down. This is where we focus on the really complex cases, specialist palliative care, medical team, and a nursing team. We also have in the community clinical nurse specialists. So they're based out in patients' homes, and they're the people that you see at the beginning of your palliative care journey. So these people are Macmillan trained, but your Macmillan community nurses in the area are St John's Hospice nurses. There are no community Macmillan nurses in your area. So if you see someone and think it's a Macmillan nurse, it's a St John's Hospice nurse. Our other service is hospice at home. And this is becoming increasingly important because 70% of people say actually they'd prefer to die at home. So we actually see more people through our hospice at home service than we do on the inpatient ward. And they come in for the last 6 to 8 weeks of life. In terms of other care work, we've got a pilot project going at the moment for a few months where we are providing day respite sits. So if you're looking after somebody, you're probably looking after them 24/7 at the end of life, and it's utterly exhausting, as I'm sure you'll know from your own experience or can imagine. So this is a couple of hours where St John's team comes in, and that gives you a couple of hours to go shopping, do paperwork, or just actually get your head down. We also offer all year round a night sitting service, which is incredibly popular because we all know that, you know, when you're sleep deprived, it's very difficult to look after someone, especially at end of life. And then last but not least, we've got a family support. So things that you will know about, such as bereavement counselling and therapies, but we also have social workers to help people who are caring for someone to know, give them an idea of things that they could be entitled to and signposting them to places of support. So in a nutshell, that's what your hospice does. Thank you, Claire. What do we want to do going forward? It's really continuing to develop the community service. So for example, like I said, the night sitting service, COVID allowing over far much more outreach work, although our community nurses and ward nurses have worked all the way through the pandemic, going into houses when other people haven't been keen to. Partnership working is obviously what we're all about. We're with you, with the third sector, and we need to balance the books. Thanks, Claire. These are patients. This is what St John's is all about. These are all people that I've met and worked with. They're real, they're not stock photos. And they've had the lady in the middle, for example, it was about caring for her at her end of life, because one of her big ambitions was to be able to attend her son's wedding. So the hospice at home team and the clinical nurse specialist did everything that they could to make sure that she could go, and she did. Thanks, Claire. I talked about balancing the books, and this is why. So around a third of our funding comes from the NHS. The other 2/3 comes from you, our community. So if anybody thinks that hospices are NHS funded, they're not. We get roughly a third, and everything else comes from fundraising, legacies, wills, events, regular giving, and that's why we fundraised so much, because basically we need to. Thanks, Claire. So looking back at what you jotted down earlier about, you know, your first thoughts that you jotted down about what a hospice service provides, I wonder if any of your thoughts have changed, if anybody's seen anything that they didn't know or heard anything that they didn't know. It would be good to know. Just, you know, bob it in the chat box. And lastly, thanks, Claire, just for the last slide now. What I'd really love is your thoughts, and again, chat box or contact me at the hospice. Really appreciate your thoughts on how we get people talking about hospice care. Because it's really, really important that we do talk about it, especially in these times when people are thinking, after coronavirus, a number of people don't want to think about end of life, but there's, you know, there is birth at the beginning of the journey, and there is death at the end of the journey, and we need to talk about it. So if anybody has any ideas, any thoughts, like I said, bob it in the chat box, or I'm going to share my email address with you all. Please get in touch. Thank you very much, everyone.
Thank you, Sophie. Such important work. I've been involved myself in the death cafes and looking at bereavement, and it's an important area of conversation that we all have to face. So thank you for all the work you do. Our next speaker is Francis Dawson, who also happens to be a member of the Lancaster Methodist Church, but he's speaking about Love Morecambe. Over to you, Francis.
Hello all, thanks for the opportunity to chat to you this evening. Love Morecambe Bay, you may or may not have heard of. You may have come across us in the context of a series of conversations that occurred over a couple of years on various themes. All of the themes had love at the start of the conversation. So we had things like love economics, love ecology, love politics. We're hopefully watch the space, hoping to sort of have a conversation on love learning in the not too distant future. So those kind of conversations are based on the concept really that we want to have some real sort of radical foundational conversations about what kind of community like we want to see in our local area, and for it to be one sort of based on a real sort of ethos of love and kindness, and of sort of community connectivity, and of you know, all of those good things. So kind of sort of emerging out of those conversations over the last couple of years, there was a kind of a group of people who sort of felt called to sort of connect together and to sort of continue those conversations and try and sort of curate and sort of carry that movement forward. And I sort of came on board in autumn as a kind of development worker, to hopefully sort of continue to sort of connect those people and those conversations together. And it's been an interesting time to have sort of started that work, of course, in this very sort of unusual year that we've all endured or enjoyed, probably endured more than enjoyed. And that's had some very interesting and sort of unique kind of challenges, really. So what I sort of tried to sort of do from the autumn onwards was to sort of connect with as many of those sort of people as I could, and to touch base and have conversations. And what was kind of like really sort of evident is that there's so many people in our community, and many of you are here sort of this evening who are really passionate about our community, are really like pouring heart and soul out into sort of serving our neighbours and our streets and our communities, and that's wonderful. And it's been really sort of like humbling, really, to sort of touch space with sort of various people and just find out about the incredible things that those people are doing. But I think kind of like something else that's kind of like sort of came out of those sort of conversations is that sometimes it's really quite hard, and it's really quite sort of like grueling to be somebody who is a caring person and is sort of caring for our communities, and that often there is quite a sort of a personal cost as well, really, and a cost in terms of burnout, kind of in terms of the challenges of doing that sustainably, and that's absolutely something that I've been aware of, at times in my own life, really. But kind of like sometimes I've really, been all out and pouring myself out and doing this, that, and the other, and then I've hit a brick wall, and it's so my own kind of experience of my failure, if you like, and in that regard, I think it's something that I've really wanted to sort of like draw upon, and hopefully kind of help us to be people who are loving and caring for our communities in a way which is sustainable, and in a way which doesn't sort of end up in burnout, really. So I'm very, very, very far from being an expert in this area. I'm very much a learner this evening, but I'm somebody who's very interested in these questions about how do we care for the carers, how do we make sure that when we're caring for other people that we're also caring for one another, and for ourselves. And just a few sort of like reflections, I think, sort of during this period, it's been interesting in some respects, because I think while we've been living in quite a sort of online, sort of virtual world, I'd suggest there probably has been a bit more opportunities for checking in with one another. I know of like sort of several sort of groups of that sort of nature, really, where people just every week or two, and their own sort of circle of colleagues or their sort of circle of peers are logging on, and just having some sort of checking in situations. And I think that's something really positive that's come out of this period. And I suppose one of my questions is that something that we can continue with kind of once, touch wood, we sort of are emerging a bit more into the real world and away from the virtual world. Is that something that we can continue to do, to have those sessions of coming together and checking in with each other, not any big agenda or anything really, but just kind of, hey, how's your week been? How are things going? I think that's definitely something we need to sort of maintain and continue with. So as I say, I'm very much a learner and not an expert. So thank you for listening to my blatherings, and I'm really looking forward to hopefully sort of getting some more ideas together this evening. Cheers.
Thanks, Francis. Having been to some of those love events, they were really resourcing and inspiring, and also they recognise that it's good to stop and actually think about what's really behind what we're doing, the philosophy and the thinking behind it. So really look forward to what comes next in the project. So thank you again. So our last speaker before the breakouts is Jan Gomez from Positive Futures. So over to you, Jan.
Thank you. First of all, I am sending out a virtual hug to everybody, because I know one of the things that the people we work with are missing more than anything is a massive hug. And people come into us every day and you can see them come near us and you can see they're so desperate for a hug. We do have, we have like lots of different things that pictures we printed off and we give them out to people. I just hope they don't take them as IOUs, or we'll just be hugging for the whole of next year, which wouldn't be too bad a thing, but we wouldn't get any work done. So so Positive Futures, what do? We're based on White Cross in Lancaster. We've got 2 big units, and we support people to improve their mental health and well-being. Who are those people? Well, they are the public. So a typical group of people in our place are carers, people recovering from substance misuse, people that are probably still trying hard to recover for substance misuse, people with learning disabilities, people with mental health issues, some diagnosed, some not diagnosed, people that have just got barriers to life, a lot of people who are isolated. So I just think it's the general public. We have an open door policy. We don't risk assess everybody, although it is a very safe space to come to. What I really wanted to say was how the dynamics of how people are coping and groups of people are managing. We have a lot of people with mental health issues who really need carers themselves, but are caring for a partner. So we are working with people who desperately need support, and the support we are giving them is to look after themselves, because they need to go home and support their partners who have similar issues or are very, very poorly. We have people who their mental health is an issue, as Colin said earlier, and I think Lucy knows this, because the people they're caring for, they've got to breaking point through COVID. And even though we've had small breaks in COVID and we are phoning all the time and we are texting and we are Zooming and we're doing all sorts of things, they've got no certainty coming up. And the lack of certainty is absolutely bringing them to this breaking point. If they, and none of us know, but I'm just talking about carers, if carers knew that, okay, on the 5th of January, everything reopens, and, you know, we have parents, and some of them, you know, in their 60s and 70s that drop off their 30-year-olds that have learning disabilities. And although the person with learning disabilities comes to us and have a brilliant time, the parents, if they're honest, it's their respite time. And they've missed all of that. And the uncertainty is, will you have to close for 4 more weeks? And, you know, Zoom is brilliant. What Francis said was fantastic, this checking in with Zoom. But a lot of carers can't use technology. And when lockdown came, we didn't have a means of teaching people. So I think if the City Council are listening, when we get back, we need hubs like ours to get funding, not just ours, Cornerstones, people like that, to get funding, to get people in, to teach them to use Zoom confidently and happily and safely, because we got lots of people to download it. We were stood 3 meters apart, 2 meters apart on people's doorsteps trying to say to them, right, what's your... you know, we were going out to houses and during the first lockdown and saying, we need to log on, and trying to get them to step back so we could get their Wi-Fi to try to teach them. It's too hard, and it's very frustrating for people. And another message, besides all these hugs that are needed, don't forget people to ring people, and don't forget to write to people, because that's what we did during lockdown. We didn't just think, right, let's Zoom. We put things online, we did Zoom, but we're forgetting some of the things that some of our carers, it's very traditional for them. And I can't tell you how many people said, a handwritten letter, Jan, it was fantastic. And I write like a GP, so nobody can read what I say, but I think just opening the envelope. And, you know, a lot of people do say that we don't get post anymore unless it's a bill, something about benefits, something that frightens them, because we normally get those letters to open for them. So my message tonight is, we don't always have to think outside the box. We don't always have to reinvent the wheel. Just remember those things. Ask them, how do you want us to communicate with you? What's the easiest way? What's the best way? And when they say, because I have a lot of people that still have the fold-up phones with no camera on, and they can hardly see the numbers, and they don't text, and they say, oh, well, we'll wait till lockdown's over, Jan, and then, you don't worry about it. But actually, those people are suffering. So I think I'm just sort of saying, let's look at individualised support. Let's look at individualised communication as much as we can. I mean, it nearly brought us to our knees as an organisation, but we can get up off those knees again. Like Francis said, we've had to support one another a lot, because where we can often just deal with the situation, no matter how complex it is, everything became complex. So that's it from me, really. It's to say, I mean, I love what we're doing. We deal with anything between, we were dealing with, before COVID, we were probably dealing with about 120 to 180 individuals a week. Now we're dealing with we're probably dealing with between 80 and 100 face-to-face, because we haven't got our Morecambe, where we're based in Morecambe isn't available, but we've probably got about 240 now with everybody we do well-being calls with every week. So we need to look after ourselves. That's really important. But I think one of our biggest worries is that people think, right, well, we're about to all shut at Christmas on the 18th a lot. Do you know, mental health services shut? And mental health services open 9 till 5. I won't go on about all of that because it's not their fault, because they're fighting a big battle. But the 2 weeks between Christmas and New Year will not be normal for anybody. I can tell you, for the first time in 37 years, I'm not extending my dining room table. And I've had my dining room table since we got our first place, me and my husband. And I'm not extending it. But, I've still got company. So as an organisation, we will still be phoning everybody all the way through Christmas and New Year. And I think as a wonderful, wonderful area, we need to be thinking about what else can we do through those 2 weeks. If not, we're going to have those people that are already very marginalised and vulnerable are going to be suffering. So that's mine. Communicate individually and look after one another. Thanks, Simon.
Thank you, Jan. Thanks for all that passion and reminding us the importance of connectedness, the importance of touch. My word, how we've missed that, and how much that does, which can't be done by words sometimes. So thank you for that. That's been a great clarion call for what Christmas can be about. So thank you. So we're going to move into our breakout rooms now. And we had planned for about half an hour. So are we still looking to do about that, 25 minutes perhaps? Kevin, do you need to explain to folk, or are you just going to send people a message saying, click on this?
Yeah, just quickly, you're automatically going to go into a room in just a moment's time. And then about 2 minutes before that finishes, so in about 25 minutes, you'll get a message letting you know to wrap up the conversation. Each room has a facilitator, so you'll have either Caroline Walsh or Caroline Jackson, Claire Muir, or Rachel Tyrrell Smith as your facilitator, who will kind of guide you through the questions. So are we ready to go into those rooms, Simon? Is that?
Yeah, let's go. Yeah.
Okay, see you all soon.
Thank you. Hello, welcome back, everybody. We've got a little less time than we'd hoped for at this point, but we would like to allow facilitators from each group to give some feedback, but the notes will also be available, so we don't have to try and cram everything into this last 15 minutes. But if we could have the facilitator from group 1, please.
Hi, that's me, Claire.
Hi. Thank you, Claire.
Gosh, that absolutely flies, doesn't it, that time? Yeah, so we only got through the first section of that, but we had some really, really good conversation. I'd just like to apologise to Vicky for my bad facilitation, who got cut off then when we got sucked back into this main room. He was speaking, but I think I captured the point. So few highlights around what's happening now. Our group discussed around St John's Hospice have a great day respite service, although we have to acknowledge that is just temporary, and that's for people who are caring for people at the end of life, and they've helped so many, well over 100 people with that, which has been great. we talked about the fact that social workers, specifically within the hospice, know to ask if somebody's a carer and identify them, so then you can provide the most appropriate support. And then going back to what Colin was talking about earlier on, we were celebrating the Carers Community Network. So that online digital network that was implemented during lockdown, that is that online digital support for carers. And linked to that, there's also a 24 hours a day chat line and a phone number. So there are some of the things that we were really celebrating. We had a bigger discussion around ideas for the future, and we had a lot of great ideas and passion in our breakout room. So firstly, leading on from what I just said there, was funding for a permanent day respite service. So through the pilot that's running at the minute, loads of benefits have been seen. So it's just about around how we can make that permanent, because of the benefits that have been found around that, and the support. Again, it's going back to you can't pour from an empty cup, and it's really keeping people well so that they can care properly. A lot of our discussion was around education. So about how in the future we need some better education to help us to identify carers, but also so carers can identify themselves. So we can have all the best support in the world for carers, but if someone doesn't identify themselves as a carer, they're not going to accept that or engage in that. So we need some kind of projects where we as a community can educate people on what a carer is. And interestingly, what was pointed out to me was that people can often go back to what their primary label is. So for example, I'm not a carer, I'm a husband, that sort of thing. So it's really helping people identify as carers as well. And part of that might involve looking at why people don't identify as a carer. Is it that primary role? Is it underpinning emotions, etc., things like that? And then leading on from that, we spoke about how we could have GP, NHS, social workers, all healthcare staff trained up to identify carers, and have that asked as one of those questions that is always asked, like a screening question, and really strengthen training around that, so that these health professionals and care professionals know to ask that question and are aware of how they can signpost. And then linked to that as well, how we can offer that sort of training into schools. So whether that's for teachers, or even we spoke about assemblies for the young people, the young pupils as well, to really increase it on the agenda, especially around young carers, and having that wider understanding of what that involves. And then we also had a suggestion about carers being a bit higher on the CCG agenda. So we acknowledge that there's slightly different offers in different areas. So it's just about how we can have a more wide approach that's streamlined and proactive to how we can support our carers. And then finally, we acknowledge that there is some great support out there for specific groups for parent carers, for young carers, for example, but there's a bit of a gap there, that there isn't anything out there at present that we're aware of for parent carers, or a network specifically for them. So that was a bit of an ask as well. So yeah, our whole conversation was focused on the carers. We didn't quite get onto ourselves, but yeah, it was a really good discussion. So thank you.
Thanks, Claire. Thanks for setting the pace for speedy feedback. With nothing missed. Thank you.
I still say as much, I just say it quicker.
Yeah, it was great. I think we're going to Caroline now from group 2. Thanks, Caroline.
Yes, thanks. And I think there's some things that definitely, I'll speed this up a little bit, because there's definitely some things that were highlighted in Claire's that were also talked about in our group. But one of the things that we've learned is, Zoom's taught us so much, the video conferencing, the way that we connect with people. And this is also for the carers as well, for those who do have access, to be able to link in via technology. But we need to be really mindful that not everyone does have that technology, and there is still that requirement very much for face-to-face. So it's getting that balance right, but we can absolutely continue on with the technology and the technical side of things, but there is still that need very much so for face-to-face. So we need to make sure we get that right. We talked about how so much is happening across our district, and all the support that is available that's currently out there, but just raising that awareness so people are aware of what is out there at the moment. And then we talked a little bit about what's going to happen over the Christmas period as well, Christmas and New Year, and making sure that people are aware of what support support is out there over the Christmas period, and there's some work I think being done through the ICCs to capture everything that's happening. So as soon as we've got that, we'll share that far and wide. And then again, I know Claire touched on that as part of their group, the awareness that not everyone identifies themselves as a carer. So I think it's about raising our awareness and raising the awareness within the community, but also being able to recognise how we're able to support people who maybe perhaps are caring for someone but don't realise that they are actually a carer themselves. We just talked as well about all the local connections, so keeping everything as local as we possibly can, having that personalised support available for people so that they can build a relationship is really important. So having that available to our residents and to our communities. We also touched on, and Claire touched on this as well, around the GPs and just reminding the GPs that there is support out there, and to refer people on when they do come across someone who is in a caring role, so that they can get the support that they need. And the final thing that we talked about was just having that local directory, which I think has been talked about a few times now, which needs to be very clear and accessible, highlighting the support that's available out there in our communities and all the work that everybody's doing, but we need to make sure it's accessible for all, for those with learning difficulties, for those with language barriers as well, just making sure that everybody can access this. That's everything that we covered.
Thanks, Caroline. Good job. Group 3, facilitator. I can't remember who that is, sorry. Rachel, is it? No.
It's me. Hello.
Oh, great.
Yes. I'm going to try and filter through the bits that have not been discussed already, so do bear with me, because we did have, like Claire's group, a conversation purely around the first section. We did run out of time, unfortunately. So the first bit was around that kind of the interaction and making sure that people know that the City Council and the general community are there for them, and that communication front is really, really paramount, and making sure that carers are recognised by others and also by themselves. So I know that the other two groups have also discussed that. So we talked a little bit about children looking after parents as carers and young carers. For that, it was a point around teachers having understanding, say if pupils are late to school, why that might be, what that looks like, and what care, and raising awareness and providing support for young carers and having that understanding. There was also the point around the boundaries of relationships. So as others were saying about the kind of husband, wife, son, daughter, not a carer, and how we can help people to recognise caring boundaries and the blurring of those roles and relationships. We talked a lot about the giving up of jobs and kind of like that previous life to take on caring responsibilities, so that once upon loss, people have the grief, but also a loss of purpose, and the need to recognise that as well. And the long-term impact of those caring responsibilities, so that some people might have the rest of their lives ahead of them, and they'll have suffered career setbacks by giving up jobs and not being able to keep up with training and that sort of a thing. We also talked about the need for drip feeding information to carers, so having constant information and providing support and peer networks and raising awareness, and that coming through county council and providing support and willingly helping, and not having to kind of battle or fight to get people the care that they need. We also talked about the low value of carers allowance, and perhaps the possibility of a pot for investments in carers who give up everything to then care for the people that they love. And overall, just looking after well-being and having that human being element to it, that we are humans at the end of the day.
Thanks, Rachel.
Thank you.
Our last group, facilitator, group 4. Caroline, is it?
Yep.
Thank you.
So I think quite a few of them I'll just touch on because other people have said them too, but we said first that caring actually is a shared responsibility in the community. it tends to end up being an individual one, and we need to reconnect with each other in order to provide that support. And that spaces are very important. So community space, outdoor space, green space, places to be together, well, not too close together at the moment, but also community hubs. And these things help us to reconnect with each other and support each other. And that we also ought to look to Europe, where there are models of doing this that we might not have tried. We too touched on that people don't see themselves as carers and the need to identify, but also that we need to have caring as part of the nature of our community, of our systems, and of our politics. That's a big ask. We had a suggestion that we should have a carers charter, that there ought to be a carers charter. It ought to be something that was national, but actually, why don't we get on with it here? A charter that is between the local authority and the third sector organisations, and so that carers know what they can expect. We talked about it being okay to not be okay, and affording that compassion to people, that and to ourselves, that you accept that you're not okay. I think we had the notion of the index of support, or the which has come up several times already, that, you know, what is it, is there, where is it, and how do we access it quickly if we need something for carers. And Oliver mentioned the virtual village hall, which lists things all over the county, and also noted that Age UK were very mindful of increasing need and the need to campaign. And the last, I think, big point was carers need support with things like particularly with physical therapies like massage, because being in your head all the time is not a strong place to be, and you need to be more in your heart and to have that strength to keep on with what you're doing, so that carers need to keep that well-being through the kind of therapies that support them physically. And then I made, so that we could do the second question, I just got everybody to say 2 words. So how do we support ourselves? Eric cheated and said 5 ways of well-being, which is well more than 2. And we practice self-care, accept help. You need time and support, be with others, dog walking, family hugs, and neighbours in the outdoors. And those were our ways to support ourselves. So thank you.
Thanks, Caroline. A great place to finish. I'm conscious that it's nearly 8 o'clock. And as this is an evening about care, it's probably a good time to draw things to a close and allow everyone to do some self-care by getting in their pajamas and having a glass of wine or a cake or something. A really big thank you to everyone who's come tonight, especially to our speakers, Lucy, Colin, Jan, Francis and Sophie. Brilliant, so much information, but such a lot of passion, such a lot of care, such a lot of fire. It's really inspired us. Thanks to Kevin for doing all that incredibly important Zoom background work that meant that I didn't have to do it. Otherwise it would have been a disaster. And a special thank you to all the folk involved in setting up these conversations and carrying them through, because they are so useful to us all. They're so resourcing. It's what we need to keep going. It's what we need to support each other. And they create this wonderful connection. So thank you for all that work. So I think just to finish, wish you all a really happy, peaceful, restful season of Christmas, doing whatever you do at this time of year. Please take care, keep safe. Our next community conversation is on the 21st of January. So hopefully in a new year, which will genuinely be a new, hopeful year, and we can put this awful one behind us. So take care, everyone, and thank you. Good night.
Good night. Thanks, Simon.
Thank you.
Good night.